Thank you, Jeremy. We had originally scheduled Michael Becich to be our panelist, and he will still play that role today, as well as filling in for Tom Fuchs. And he offered to put together a 5-minute Ignite style, which is a timed 5-minute presentation for his initial comments, and then we will assemble our panel. So, Michael.
So the disclaimer is not Ignite because I chickened out. That's harder. So this is the standard, and it'll be less than 5 minutes. So this is just really to kick off the panel discussion. There's a lot of terms tossed around for what we're doing, but terms that are starting to stick are pathomics and radiomics for this. So I thought I'd provide a little bit of context for those. So I've done my conflicts of interest. I don't have to do it. My objectives for the messages here for our panel discussion is that pathomics and radiomics will fundamentally change diagnostics for precision oncology. That's our end game. And pathology and radiology need to partner with both communities going all in and not just veneer or research. And data sharing, I think, is key. I think Amy really hit on that well. It's going to be very important to close the loop and for academic and industry partners to work together. So pathomics, for a definition, first actually appeared in the mid-2000s. Lawrence Livermore had a project, but I really like the stickiness of what they said. High throughput diagnostics to understand the molecular basis of the disease. That's what pathomics is. And we've rebirthed it as part of the R&D of pathology informatics as computational pathology. There are 2 nice papers Dave Lewis led a group of us to talk about that brought molecular pathologists, pathology informaticians, and pathology leadership together to say, okay, what are we going to do to change the discipline? Radiomics is in Wikipedia, unlike pathomics. It's the field of medical study that aims to extract large amounts of quantitative data from medical images using data characterization, machine learning, AI algorithms. Those radiomic features are the engram that we focus and essentially tease out things we might miss with our naked eye. And I think Kurt's workflow is a radiomics workflow to essentially create these engrams of knowledge that humans and computers can work together on. So radiomics and pathomics together give unlimited diagnostic power, I believe. But we're going to need to do a lot of work, as we've outlined today, to get there. And radiogenomics and pathogenomics, combining genomic data into the imaging and phenotype data from patients, are going to be key enablers. If you want to look at an industry that's validated or anything that's out there, look at the dizzying number of startups in the space, whether it be pure genomic, or if you look at pathomic or radiomic funding, validation's clearly there. Tom, I was excited to see what he had to say. Unfortunately, had to fill in for him. But he's got a startup, Page AI, at MSK that really is doing quite innovative stuff. Path AI is Andy Beck's company coming out of Beth Israel Deaconess in Boston. He's raised $15 million for Path AI, and FIMIC just raised $11 million. This is a very short list of a long and growing list of companies that are getting into the space. And radiomics funding, there's Zebra Medical Vision, Arteris, AI Doc. Plus, if you go to the RSNA website, at last year's meeting, they had 30 AI companies profiled at RSNA. Amazing. So Jeremy talked about how the technology can come to bear. It's not going to be through our electronic health record systems. We're going to need another set of systems, and Smart on Fire is a great solutions path for it. It's an interesting time to tease at these issues. So to get to precision oncology at scale, we're going to clearly need to leverage AI. And let me say something abundantly clear. Imaging data is really complex and has lots of issues that we will need to address with R&D. Both the multidimensional and multimodal methods, but I think pathologists and radiologists are up to the task putting that together. But if we really want to deeply understand imaging data, the thing that kind of ticks me off are these stories about how bad AI is and it's getting in the way, it's already screwed up. You know, one thing that's just been a fundamental defining principle for me is Chuck Friedman's fundamental theorem that, you know, if we get into this cognitive load, as Bill Stead has nicely outlined since the 2000s, we're going to need help. and computer is there to help the human. It'll be guided by the human. It'll be a tool for the human, and certainly is not going to replace the human. No fear at all about this with the complexity that's raising. But to get there, we've got to have data sharing. That data sharing is going to be key in oncology. NCI has really taken a nice leadership stance with the Information Technology for Cancer Research program. Our industry partners are leading the way, as Amy has shown. International consortiums are forming. This is an important thing. If we're going to get there in pathology, we're going to need to have good training sets. So really opening the sharing of imaging data, these high-quality data sets is going to be there, and that's what the work that I portrayed with TCRN and TIES is going to do. And we need to make this data fair, findable, accessible, interoperable, reusable, and academic and industry partnership is going to be key. So building these data sets is a central research mission. It's a lot of R&D. I think our biomedical informatics departments, like the one I have, are going to be key enablers. The NLM and their training program for biomedical informaticians and data science programs around the NIH are going to be important. And what we're going to try to do is start to support really hands-on data and datathons and hackathons with our platform at all of the society meetings. SIM signed up, the Association for Pathology Informatics has signed up, the Digital Pathology Association has signed up to promote and host hackathons. SIM has been a driving factor in this. We're in our second year of discussions. We'll get real this year with SIM. SIM is the Society for Imaging Informatics in Medicine and is the dominant imaging informatics meeting. These will all be important partners in enabling this. And, Tom's slides from a previous talk showed the scale, wow, 500 whole slide images in a competition. Well, with 5.3 million pathology cases in TCRN and 27 million images now annotated in TCRN, we're going to try to drive the scale up a little bit. So in conclusions, I think these two disciplines can work together to common purpose. We're going to need to partner and aggressively. We're going to need leadership, the member organizations, as well as train people in these conjoint disciplines. And at the core of it, to make it happen, will be data sharing. So with that, we'll go to the discussion portion.